So imaging. In imaging, we're gonna have a panoramic or PAs. We're gonna have occlusal images, conventional CTs with or without contrast. We have cone beams. We have magnetic resonance imaging, MRIs. We have PETs, which is precision emission tomography, ultrasounds, cytography, scintigraphy. So, what is one? We're going to talk about biopsies, surgical biopsies. In surgical biopsies, well, there's different kinds of biopsies. Um, Incisionals, well, surgical, fine needle aspiration, or exfoliative. So in surgical biopsies, we can do incisional or partial, which is a partial removal or sampling of a lesion. We can do also excisional, in which there is a complete removal of a lesion, or frozen sections. Okay. Next is fine needle aspiration. Fine needle aspiration. The advantages, the disadvantages is that they are difficult to reach. I mean, this is actually indicated in difficult to reach structures, regions, and the exfoliative cytology and brush biopsy, which are superficial samplings and when they lack architecture. So list one advantage and disadvantage of each. So let's look for advantages of surgical biopsies. Advantages of surgical biopsies. Well, the an example of an advantage of an incisional biopsy is that uh, that we can diagnose a lesion without being too extensive, and in case that this is contraindicated, the excision is contraindicated, we can know what it is without putting the structures at risk. The disadvantages are that we can many times we have to do two procedures if excision is necessary. So excisional biopsy will be the removal of the lesion to be examined and is most often used to diagnose skin lesions. The major advantage of excisional biopsies is that they provide the pathologist with the entire lesion and minimizes uh, the chance that a cancer in part of the lesion would be missed. So, a disadvantage of incisional biopsy is that it only provides an area of the lesion. It's not the whole lesion, so it cannot be seen in all the areas of the lesion. So an incisional biopsy, removes only one piece of the tumor or the lesion. And these are done if the masses are large. So the disadvantages of fine needle aspirations. Let's see. Disadvantages of fine needle aspirations is that the needle can sometimes miss the tumor and take sample of normal cells instead. So if this happens, the sample will the results will show that it's a normal cells are there. The advantages, the advantages of fine needle aspiration is that we don't have to access the lesion. We can just check in a conservative way for cells of the area. It's very non-invasive. It's less painful and quicker compared to other methods. What is the advantage of exfoliative cytology? The advantages of exfoliative cytology is, of course, that they are very non-invasive. What are the disadvantages? Um, Okay, advantages: non-invasive and painless, minimal skills, patient compliance, cost-effective, performed in large numbers, minimal instruments, early diagnosis of lesions, and they can be used in patients with systemic disorders where biopsy is contraindicated. They're easily done at the chair site. Disadvantages: false negative results, only an adjuvant, contamination, low sensitivity, inadequate sampling, not usable if non-epithelial lesions. So exfoliative cytology. Okay, that was exfoliative cytology. So next we are going to information to include on a biopsy request form, patient identifiers on requisition form, and the specimen container. Your identification information, name, address, phone, etc., date of biopsy procedure, description of lesion, include a photo, the site of the biopsy, indicate whether incisional, excisional, or other, relevant medical and social history, highlights of the history of chief complaint, provisional or differential diagnosis. Tengo sueño. You could have told me. You could digo, ¿cómo? I'm not looking at that. I'm looking at something. Maybe. Maybe.